Hi guys, welcome to today's episode of helping you keep your mouth clean. So today we'll be talking about an interesting topic: parenting and child dental health. So we'll be talking about things you need to know in order to keep the mouth of your children clean and to reduce complications from poor oral hygiene, as well as to reduce the cost of your dental visits. Let's not forget that habits follow children into adulthood. We'll be taking it according to age. So we'll be talking about infants from 0 to 12 months of age. Now, we'll be dividing them into two groups. For those that are 0 to 6 months of age, where there is usually no teeth in the mouth, you can afford to do without toothpaste. But there are exceptions. There are children that from 4 months of age, they have teeth in their mouth. So for those who do not have teeth in their mouth, there will be no need to introduce toothpaste or toothbrush. What you can do in that age, you can do two things. You can either leave it alone. You can leave it alone. The mouth is self-cleansing. Breast milk is self-cleansing. Then if you are formula feeding, the child will be taking water, and that is enough to clean the mouth. But you can as well, if you choose to clean, or when they are dead, plaque or cords like deposits on the tongue of the child, then there is a need to clean. So in that phase, you use what we call a soft towel. You can use a soft towel, just a small towel, a soft one, and plain water to clean the mouth of the child. You can clean the surfaces of the mouth, not just the gum pad. You can clean the cheek. Anywhere you think there are deposits, you can clean. Or you use lukewarm water, really lukewarm water, with a pinch of salt, and then use a soft towel and clean. Then we have some silicone mouth cleaner for infants. Yes, you have to insert your finger inside the silicone finger cleaner, and you can use it to clean the child's mouth as well, especially the tongue, because that's usually the surface where accumulations occur in children that do not have teeth. Now, as soon as teeth comes, usually at 6 months, let's not forget I said some people have teeth earlier, but for those who wait until 6 months before their first teeth come, so welcome toothpaste. As soon as there is teeth, you welcome toothpaste into the child's mouth. So you get a milk teeth toothpaste. The milk teeth toothpaste has fluoride concentration according to what is adequate, just enough for children. So you can use the milk teeth toothpaste. Some companies have just labeled from 1 to about, from when the twin teeth comes to about 4 years, some of them 5 years, but around that toddler age, you still use the milk teeth toothpaste. So you use the milk teeth toothpaste and then a soft toothbrush, the size of children's size. Yes, you use it to clean the mouth morning and evening. So you clean the mouth twice a day. It's advisable you clean twice a day. Fluoride containing toothpaste. So you watch my video on teeth cleaning, and then you see how to go about it, like the techniques employed in teeth cleaning. Please don't miss out that video. It's essential for everybody to watch that video on teeth cleaning. Now, so you don't think you are cleaning and you're cleaning wrongly. Another thing about children that are around 6 months to 1 year is their first dental visit. That's not their teeth in the mouth. Please, that's the time for your child to familiarize with his or her dentist. Take the child to a dental clinic to have the first dental visit. So that allows the child to get used to the dental clinic and then sees it as a routine place for visits. So it helps to allay fear when they now come for subsequent visits. They are introduced early. All we've done will just be a baseline check and recording. That's all that is most likely going to be done for that child. But please institute the first dental visit before the child is 1 year of age. Now, let's move on to the next group of children who are above 1 year of age. So for those that are around 1 year to 7 years old, please, initially you brush for the child, but around toddler age, children like to do things themselves. They want to be independent. Yes, you can allow them brush their teeth, but you supervise it. Supervise the toothbrushing. Do not have them brushing in the bathroom while you are in the kitchen cooking. No. It's not advisable. So while they are brushing, you supervise them. Which surface have they not cleaned? Oh, you've not washed this part of your mouth. You've not washed this. Even when you allow them brush, if you know that they are not using adequate motion or force, then you can assist them. So it's like an assistance. You are assisting and then you are supervising up to the child is around 7 years of age. You shouldn't allow your children that are less than 7 years of age to brush unsupervised. It's actually not advisable. So you supervise their teeth brushing. Another thing about these people that are between 1 to 7 years of age and even beyond is that it is around that point that there's a transition. First of all, their baby teeth completely comes out. Like from 1 year of age, they start erupting other of their baby teeth, apart from those that came between 6 months to 1 year. And then around say between 4 to 6 years, some of them start changing teeth. You see the milk teeth, that's the primary teeth, fall off for the permanent teeth to come in. So at that point, when the primary teeth is going off and the permanent teeth is coming in, for some children, they may coexist in the mouth. So you now have something like crowding, like there are so many teeth in the mouth, one in the front, one in the back. You know that kind of situation where that's it. Oh, mommy, I have double teeth. Don't be anxious, just calm down. There's something about it. So if it didn't fall off for the permanent one to come, please take the child to the dental clinic so it doesn't stay for so long and make the permanent one to stay in that other position, which is not actually meant to be the final destination. So you take child to the dental clinic and then it will be sorted out. So that is what you need to do. That transition between the milk teeth and permanent teeth is a very critical phase. If you play with teeth, your child could have malocclusion. You see these people that have their teeth arranged not orderly, not in the curve of the mouth. So that is what you need to do. So at that point, the mouth is crowded, so there is room for teeth to deposit. Sometimes it appears as if the teeth are looking as if they are pointing outward, or they are all so much actually at the front of the mouth. This is the time where you must brush morning and evening so that there won't be dirt accumulated. Please, it's advisable you brush morning and evening, morning and night. Okay, so that's it for children. Then let's not forget, it is this age, it is still in this age that they start habits. You know that thing they say they don't learn how to use left hand in old age. So you can't see somebody that is okay, it's not really so common for you to see a child that is 9 years old starting to learn how to suck the thumb. They usually start between that 1 to 7 years old. That's when they start learning how to suck the thumb for reasons. That's another topic. Yeah, I have a video on malocclusion and what to do. So try and watch that video on malocclusion. So now it is between this 1 to 7 years they start sucking their hand, tongue thrusting, biting, lip biting, and all that parafunctional habits. It is within this age. So when you see those habits, try as mothers to stop. If it is dialogue that works for your child, do it. If it is shouting at it, whatever that, in fact, anything that's acceptable in your culture, in your community, that works for you or works for your household, that is acceptable, you do it. But if the child does not stop those habits, please bring the child to the dental clinic to see us. The child will be placed. There's some appliances that we call habit breakers. Yeah, habit breakers, that's what we call it. So I'll be portraying some images in the screen. You see them. So those appliances are meant to stop the child from those habits. The child will not really have control over it. It's just automatic. When the child is running that habit, it's most likely there's a very large percentage that child will stop the habit. So after the habit is stopped, it will prevent, because if you allow those habits to stay, if you allow the habit to linger, you leave it, as the teeth are erupting, they are taking the position that the thumb and the tongue is pushing them to. So you see them having malocclusion, and then later in life you have to treat with more extensive dental treatment instead of just breaking habits. You see having to wear braces and other, maybe do extractions just to make sure that they're able to align the teeth that are not well aligned. So that's it. Children that are over 7 years of age, yes, you can allow them brush their teeth, and this time around with medium bristle toothbrush. They don't need soft toothbrush again. At that time, soft toothbrush will not be enough or adequate for proper cleaning. So they can use medium bristle toothbrush to clean their teeth twice daily with adult toothpaste. So like I said, watch my video on teeth cleaning. You see the way to clean. You see how to clean, how to brush the teeth and the gum. Don't miss out that video. So if you want the children to take semi-solids, grind it with your plastic mortar, or you use your blender to grind it, or better still, please go for food options that come in semi-solid formats so you don't have so much stress. Allow children be children. Let them eat children's food. When they're adults, that means you want them to eat. When they're adults, eat it. So they are eggs, at least they're not so hard. You can just smash and then you give a child. So there are other sources of protein. Either you grind or you give them food that are in semi-solid form. Please do not chew with your mouth. And then kissing. Please let children be children. I know you want to bond with your child, hugs, pecks. Please don't be doing mouth to mouth, please, with your children. That's the advice. So you don't transfer those microorganisms to their mouth. Let children be children. I always emphasize on that. Let children be children. Don't give them mouth to mouth kiss. Hug a child, give a child a peck, but please avoid mouth to mouth kissing. Just avoid that. The sharing of toothbrushes. Toothbrush is something that is affordable in almost every country. Around the world, toothbrush is affordable. Please. Adult toothbrush is adult toothbrush. Mommy, daddy, have your own toothbrush. First child, second child, third child, everybody should have the number of children that you can buy toothbrushes for. Please do not share toothbrushes. It is not advisable. Do not share toothbrushes. At most every 3 months. That's the minimum requirement. You should change your toothbrush for yourself and that of your children, but do not share toothbrushes. Please do not share toothbrushes. That's another way you transfer. You see a child was having holes, later on the other sibling is having holes. When too much share, don't share toothbrushes. Please, please, please. Let this person have the one that this person has. This other person has the one that this person has. Please do not share toothbrushes. And please go for routine dental visit. Don't wait until your child has hole, oh pain, this. No. If you go for your routine dental visit every 6 months or every 1 year, you take charge of the dental clinic for examination. At most, just consultation and then examination. You will find out that just try and see my video on affordable dental visits. You see how one person will be spending so much on dental visits while the other person will be spending little or nothing. So early dental routine dental visits, very important, because faults are detected early. Early signs of malocclusion detected early and averted, treated, than waiting for it to become full-blown malocclusion. Please, let's try to have routine dental visits at least every 6 months to 1 year. The child should see a dentist. Do not let your children sleep. Oh, this one. Do not let your children sleep with sippy cups or straws in their mouth, especially when they're taking fluids or semi-solids that contain lots of simple sugars. Please let them not sleep with those cups in their mouth. Remove them, because you just allow the teeth to bathe in those fluids or semi-solids that have lots of sugar, and that could increase your child's tendency to have holes in the teeth that we call dental caries. Now, let's not also forget that when these children were born, they were taking breast milk or at most formula, which does not have so much of simple sugars. So when they start doing, I take too much of chocolate, too much of sweets and all that, you input it for them. You introduce them to it. So part of the blame is ours. So let's try as much as possible to care for our child's health. So healthy children are the joy of the parents. Like, most parents do not want to be going in and out of the hospital. So try as much as possible to make sure that you maintain your child's dental health, optimum dental health, so you can have peace and joy, except you want to visit the clinic routinely. So now guys, let's not forget to click on the like button, subscribe to my channel, as well as turn on your notification. See you some other time. Bye.